Okay, in the interest of time, just be respectful of everyone's time. We're just going to go ahead and get started on time. It's 6 o'clock, so we're just going to dive right in. Folks will probably join later on. That's totally fine. For everyone's awareness, this is a recorded training. So be mindful just to keep yourselves muted and keep your cams turned off. This recorded training will be posted to our Philly MRC YouTube page shortly after this training, if not tomorrow morning, so you have access to it whenever you need to review this information. All right, as always, my name is Satori Gibson. I have the pleasure of being your Philadelphia MRC coordinator. And really quickly, before we introduce our presenter for this evening, I just want to let everybody know, if you haven't, noticed or have been notified, we do have a new workforce MRC specialist. Her name is Sonia Habel. You'll be seeing her, getting to know her. She'll be on other future trainings. She's supporting us on this one right now, but we'll have her introduce herself at a later date. But for right now, I'm going to turn it over to Margaret, and she'll take it away with her training that she'll be providing for us this evening. And I'll be monitoring the chat if anybody has any questions or anything like that. So with that being said, I'll hand it over to you, Margaret, and thank you so much for providing this for us.
Yeah, thank you so much, Satori. I'm definitely very excited to be here. First order of business, can everyone hear me okay? I had some mild tech issues, conveniently a couple of minutes before we began. I see some thumbs up. Amazing. Okay, great. Yeah, so it's wonderful to be here with you this evening. My name is Margaret Zeller. I use she, her pronouns, and I'm the at-risk populations coordinator for the Public Health Preparedness program. And I'm really excited to be here to speak with you this evening about one of our flagship operations and outreach events that we conduct, which is the Homeless Outreach Vaccine Team and the mobile clinics that we provide. So we're gonna go ahead and get started. All right, so just a brief agenda. I'm just gonna provide some background overview context of what these clinics often entail, as well as the volunteer opportunities where we would love to have your support. And we have enjoyed your support over the years as we have continued to provide these clinics to at-risk communities throughout the city. What exactly we provide, especially if we're talking specific vaccine products, and then finally the fruits of our labors, the outcomes. All right. All right, so let's dive into some background, first order of business. I'd like to start with what is the mission of our homeless outreach team. Overall, our goal is to increase access to information and resources for people experiencing homelessness and organizations that serve them both before and during public health emergencies. That's a bit of a mouthful, but overall, the Public Health Preparedness Program is looking to support communities before, during, and after public health emergencies. And the whole entire goal of this particular team is again, if we're focusing on at-risk populations, looking at the folks who often are forgotten about or left behind when these major emergencies are happening. We're just very excited to be able to share the work with you as well. All right, so a little bit of background on how this team first came to be. In some ways, it feels like a million years ago, I'm sure. But in the early days of the vaccine rollout in the wake of the COVID-19 pandemic, there were a lot of logistical components that had to be ironed out. Pop-up vaccine clinics, as well as trying to get large numbers of people vaccinated in a very short period of time. And naturally, in these situations, looking to prioritize people that were especially at risk. If you think of people experiencing homelessness, they may be living outside or living in congregate living settings, which is not a good combination for something as easily contagious as COVID-19, especially if you think about the experience of severe illness, if someone catches it, and just being able to very easily spread. Throw in the fact that a lot of these communities also experience and often feel a lot of mistrust for both the healthcare system and government entities, such as ourselves, as often due to a history of stigmatization. It was a bit of an uphill battle. Not just that, with the original vaccine clinic models in the early days, there were a lot of barriers put up to not intentionally decrease access to these clinics, but it did make it more challenging for folks in these communities to access vaccine, things such as appointment requirements, proof of residency, not to mention competing priorities, something as simple as approaching a clinic and not being able to bring your belongings in with you. Not to mention just the general misinformation and distrust revolving around vaccines that we still experience today as well. So that is where our clinics first came to be. The preparedness program ended up determining the most vulnerable populations and communities throughout the city and finding the areas of the city where they were most concentrated to prioritize what we call pods or point of dispensing sites. So how we did that was really working with our community partners. Think our homeless services programs, so recovery homes, safe havens, places that did not have explicit on-site vaccine access, where we could ultimately meet people where they are. And as I said, a lot of the major legwork in this was very much with our community partners because they were the ones who were on the ground helping us identify, okay, where do we need to go? So that's how this team came to be. Now let's go over the team itself. So, as I said, this is a mobile team model. We are very much not a brick and mortar. We meet people where they are. The setup is often quite humble, just a folding table and some chairs, as well as our various vaccine and outreach supplies. And we can set up just about anywhere. We set up outside in areas where folks congregate, shelters, etc. And we do include other services, particularly outreach items that are seasonally appropriate. Other items that we have provided in the past include STD testing. We don't necessarily do that as much anymore, as well as wound care supplies. So that is that for the team model itself. And as for who makes up this community, it is primarily a mixture of PDPH employees, particularly folks from the preparedness program. We sometimes have some other people from different programs look to join us, as well as wonderful MRC volunteers like yourselves. Historically, these clinics have been set up all over the city, but currently the primary areas of focus are here in Center City as well as in Kensington up in the Northeast. And we particularly work with unsheltered populations because those are where these particular communities are most concentrated. We often also see other at-risk communities outside of people experiencing homelessness and people living outside, such as people who use drugs, sex workers, and other marginalized communities as well. And as I said, we can do all the coordinating and all the rest, but none of this works without the support of MRC volunteers like yourselves. And I'll get into the specifics of that in just a moment. All right, so let's get into what exactly volunteering at these clinics looks like. So at least with where we currently are running our clinics, depending on the location, clinics typically run between 2 and 3 hours. That does include setup and cleanup. We do kindly ask that you help us set up the tables, such as getting, the table set up, perhaps wiping the table down, getting the chucks taped down, getting outreach supplies out as well. We are coming from the office, often a wild sight to see. We're just bogged down with Hulken bags and vaccine coolers and all the rest. So help is appreciated. Because as I said, we also do provide outreach and harm reduction supplies, and that is provided to folks who are just interested. It doesn't matter if people are looking to get a vaccine. The fact that they come up to our table in itself is inherently a win. And the whole name of the game, at least if we're talking from a clinic model, is a low or ideally no barrier model. So that means folks don't have to make appointments, they don't have to provide ID, insurance, they don't have to pay, or even provide proof of prior vaccinations, because we do have access to the citywide vaccine record system. So in the event that person has had a vaccine here in Philadelphia, we can typically look it up, or at the very least troubleshoot if they've had one out of state. All right. So as for the folks who are physically there on a given day, we are often comprised of a, a clinic lead. They usually run outreach and just run line staff to keep the clinic flowing at all times. A vaccine manager, somebody who keeps track of the vaccine that we have with us in a big cooler, and just keeping track of the inventory to make sure that our supply is flowing. As well as data collectors. We have a data collector matched up with a vaccinator. So the patient or the participant's health information can be recorded as the vaccinator is discussing potential options with the patient, as well as to vaccinators. And we particularly look to your support to actively provide the ability to vaccinate at these clinics. Like I said, vaccinators are paired with a data collector. The data collector inputs information as vaccination is occurring, also helps the vaccinator with screening for any contraindications, recording the vaccines, etc. So you have, let's say you have been assigned to one of our clinics and we'll be expecting you. Let's talk about what it looks like to prepare for deployment. First order of business, full stop, your safety comes first. In the event the clinic is outside, make sure to check the weather and make sure to dress accordingly. We have had clinics well into December and in the heat of July. So if it's hot out, make sure that you have, especially if it's an outdoor clinic, sunscreen, bug spray. I'm a fan of sunglasses and hats. Or if it's colder out, make sure that you dress for the weather as well. Closed-toed and sturdy shoes. We're vaccinating, so that means needles and sharps are out. So that is inherently needed no matter what. These clinics can sometimes be scheduled during meal times. So could be like 11 to 2:30, for example, or 12 to 3. So making sure that you bring some water just to stay hydrated, or even just a snack, that's always a great idea as well. These clinics can sometimes be in areas where parking might be a little bit of a challenge. So making sure to provide yourself ample time for parking is recommended. And there's absolutely nothing wrong with calling in the event that you're having trouble. I try to make sure that MRC volunteers who come to clinics have my number. And in the event you are parking on the street, making sure that your valuables are out of sight. Some of the areas in which we have these clinics are often higher need. It's just also we live in a city. It happens. Along with that, and I'd be happy to provide this in the chat once we start getting to the tail end of this evening. We also recommend completing Narcan training if you've never had that prior to deployment. As I said, some of our clinics are in areas where it's not just people experiencing homelessness, but people who do use drugs. So it is just good to keep your bases covered. And then also in the event you are leaving the immediate clinic site, let's say to run to the restroom, it's always best to travel in pairs. Excuse me. All right, so from here, we're going to talk about vaccine products. What is it exactly that we can provide? So historically, we have been able to provide 5 different vaccines. COVID, I'd say that's pretty name on the tin, pretty obvious. We do provide Moderna Spikevax and their pre-filled syringes. We also provide flu vaccines when they become readily available in the fall until we run out of our allotted stock. So for example, technically right now we have a small number of flu vaccines left over from last season. I'm talking like maybe 15 to 20. And then also hepatitis A and hepatitis B, and finally Mpox. You'll notice that with public health preparedness, the whole name of the game is responding to what is considered a public health emergency. With all of these vaccines, you'll notice that they are affiliated with some sort of public health emergency that has either happened or is currently ongoing. So the COVID-19 pandemic, COVID vaccine. Seasonal flu shots to prevent severe illness from flu. We have flu shots. Hepatitis A outbreak from a couple of years ago. Mpox outbreak that has been ongoing from a couple of years ago. We provide that. And we provide all of the supplies, all of the syringes. We provide the sharps containers, Band-Aids, alcohol wipes, all of that stuff. So you don't have to worry about that. All of that is provided to you. And we also make sure to provide vaccination supplies to accommodate people with a variety of needs when it comes to vaccination. So varying gauges in the event someone just simply doesn't have as much meat on their bones, etc. All right, and then as for the screening, this is just something that we aim to ask each time we vaccinate. You know, how are you feeling today? Are you feeling sick? Have you ever had a bad reaction to a vaccine? Are you allergic to anything? We just tried to make sure that these are answered before we officially put a needle in someone's arm. All right, so we've gone over the lion's share of what goes into these clinics, and it's really heartening to see the general outcomes and the data steadily accumulate over the past couple of years. Since 2021, we have held 260 clinics, which is crazy to think about. And at least as of our last clinic, just a couple of weeks ago, we have administered 7,315 vaccines. And you can see the breakdown over on the left side of the screen on just that breakdown. Obviously, a good bit of COVID vaccines, but also a very nice amount of hepatitis, and a couple of others. And then we had pneumococcal for a very, very brief moment, but we don't provide that anymore. But I also do just want to especially emphasize that number down on the right-hand side of the screen, the number of MRC hours that were clocked. Special thanks to Satori, Sonia, and your intern, Keely, for compiling that number for me. So, you know, we're looking at almost 600 hours of work and dedication from the MRC, which is really wonderful to see. I have explained that we do also provide outreach supplies depending on the season. Not just supplies, so like, you know, think in the summertime, we often provide bug spray, sunscreen, cooling towels, things like that. But we also work to provide other materials as well, where it's not just, you know, physical items that folks may need when it's really hot outside, but also we work to develop communication materials, not just in partnership with trusted organizations, but that also are made with a harm reduction lens, and provides information, not necessarily about just vaccines, but even just how to function during the summertime. So, for example, this is our palm card that we make every year, and we change it and modify it to make sure that all of the information on it is correct, especially if you look at those emergency shelters or drop-in centers, making sure like the times and the dates are accurate. I know that may seem like a small basic thing, but just making sure that as much up-to-date information is brought to folks as humanly possible, as well as forget vaccine preventable diseases, heat related illnesses as well, heat exhaustion, heat stroke. We have hepatitis A mentioned because sometimes there's a mild uptick of that during the summertime when it's warmer out, etc. And then same goes for winter as well. Of course, during the winter time when it's cold out, you got to think about the cold related illnesses, hypothermia, frostbite. What does it look like when the city goes into a code blue? What are those drop-in centers? Where are they located? It really can make a difference between somebody being okay for the night and not. As well as information on respiratory illnesses and things like that. We do our best to tailor it by season. So I do believe that brings us to the end of our training together. I do just want to give a very hearty shout out and thank you to the MRC volunteers who have come out to support our clinics. Your dedication and just the sheer amount of effort that you put into things to carve time out to come and join us is not unnoticed. I'm sure Satori agrees with me as well. And we also are really hopeful and eager to see more of you, meet more of you, and provide you opportunity to get to know the folks on our team, and also get more fieldwork experience if that's something that you're looking for. I am I think I can speak for the folks on our team when I say that. So thank you so much. In the event you do have questions, my email is provided on the slide. No question is silly. Please feel free to ask. And speaking of questions, if you have any questions right now, I'm happy to answer them. So thank you.
Thank you so much, Margaret. And you're getting a lot of thanks in the chat as well. I don't know
Oh,
if you
great.
answered this question already, but someone asked, do you ever coordinate with the courts?
With the courts, I imagine you're talking about like the local Philly courts. Typically, no. Who we do coordinate with include um community-based organizations. So, like for example, the two main area locations that we do often coordinate with are Prevention Point, which is a harm reduction organization up in Kensington, as well as St. John's Hospice for Men, that is a shelter here in Center City. I don't, at least as far as I'm aware, I don't believe we have coordinated with the courts until ever, as far as I'm aware. I hope that answers your question.
I see that being the only question.
Okay.
Texas, thank you for answering this question. And then if anybody else has any further questions or anything that's not necessarily coming to mind now that you want to ask later, please feel free to reach out to mrc@phila.gov, and Sonia and myself will make sure that Margaret gets your questions and we'll make sure everything is answered. But once again, thank you so much, Margaret, for doing this for us. We greatly appreciate you providing this training. And thank you to everybody who's joined us this evening. We know it's a Monday afternoon after work, so we greatly appreciate you spending some time with us. And there'll be additional trainings coming up in the future. Sonia and I are doing our utmost best to make sure that there's consistency with the virtual trainings. And so our next one will actually be the first of a mini series that we just kicked off. And it'll be focusing on different types of disabilities. That'll be on Monday, April 14th at 6 p.m. We keep them around the same time just for the convenience of everybody and the consistency as well. So if you're interested in that, we'll be sending out reminder emails. You can check us out on LinkedIn as well for any updates. And once again, thank you so much. And we all hope that you enjoy the rest of your evening. And with that, I'll hang out if anybody has any questions or anything they want to throw at the chat. But other than that, we'll wrap it up. And this recording, like I said, will be uploaded to the Philly MRC YouTube page shortly after, if not tomorrow morning. All right. Thank you so much.
Thanks, everyone. I do see one last question in the chat. I will go ahead and answer. Nesreen, I see that you're asking about any upcoming volunteer activities. That's a great question. So, as I've kind of mentioned, we do move in a rather seasonal cadence here at Preparedness. Satori, I'm sure you agree with me. So currently we have all of our spring clinics currently scheduled, and I believe, that is through mid-May at the moment. Once we have explicit dates and times tied down with our community partners, that's when we will be releasing the next batch of clinic dates for the summer through probably early September, I'd say. So I guess all I can really say is just keep an eye out for any correspondence from Satori and Sonia pertaining to that. Nesreen, I hope that answers your question. Okay, great.
All right, and I'll be sending out, and Sonia as well, as Margaret mentioned, we'll be sending out any updates for any upcoming volunteer opportunities that pertain to the
Absolutely.
any clinics and stuff like that. There is also a survey that we sent around for anybody who's interested in this kind of work. We'll be sure to send that out again, and then we'll also post that on LinkedIn just in case anybody has, any interest in registering and signing up for those opportunities. So like I said, that information will go out. We'll also be releasing like monthly calendars of some activities and updates that will be soon to come. So with that, again, thank you so much. I don't see any other, questions in the chat, so I feel like it's safe to call it. But if you do have any other questions or like I said, anything comes to mind, feel free to always reach out at mrc@phila.gov. And thank you so much for joining us. Good night, everybody.
Thanks, everyone.